And I'm live. Hello, hello, hello. Wherever you are in the world, good morning, good afternoon, and good evening. My name is Leia for those who don't know me, and I'm a nurse, and I'm an online business owner, and I'm a mentor. So I'm going to talk about Nurses Week. So, yeah, nurses has been appreciated. Within the Nurses Week, there's a lot of activities in the workplace, free food, free small things, pens, and some other things that we can utilize while we're working on the floor. So, as you can see, I keep saying I'm a nurse, but I'm not wearing a scrub, but because of the nature of the work that I do. So, for those who don't know me here, I'm a nurse, yes, but I'm in the behavioral health. So we come to work on street clothes because of the nature of our work. And that's why you see me this. And yes, Nurses Week, some reflection. So what happened really? So we are being appreciated, but do we really feel appreciated? That's another level of question. So that's personal. Now, I'm in a psychiatric unit. I'm doing case management and I'm running a caseload and I'm helping people with mental disabilities. And mental disabilities runs from schizophrenia, schizoaffective disorder, and now there's a drug-induced psychosis. So all those stuff, and some other behavioral issues, some with personality disorders, some with autism going on, ADHD, and but primarily the diagnosis is schizoaffective disorder. So more on the psychosis side. Now, Nurses Week. As nurses, we come to work with our heart. We pour every single thing and helping other people. But the reality is, after Nurses Week, it seems like it's just, it's done, it's gone. And we come back to work and we come back our normal routines. And yes, as we move along, um, we aren't like becoming younger each year. So there's a tool for giving out our best. There's a limit. I've known nurses, they become injured while working, and that it breaks their heart because they love nursing. That's why we're into this profession. No one was forcing us on this profession, but we do uh, study and become a nurse because we want it. But the reality is, when our body is like responding to the constant stress in our work and in life in general, on top of that, there's a limit. So I've seen nurses who broke and become a patient themselves. I've seen nurses who suffered some physical injuries, and now the transition of becoming like from independent to dependent, that's a huge transition. So, well, in my line of work, exhaustion is there. So, the moment I clock in, this is my personal journey. The moment I clock in, the adrenaline rush coming up, 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 up. Now, when I clock out, it will drop. So, what happens when it drop? Um, I'm forcing myself at home to be, you know, to have other chores. I have other responsibilities. We have life when we clock out. We have life outside from that. So I force myself because there's no one. I wish I live in a country that I can hire people to do that for me. But sad to say, not here in the US. So, yes, exhaustion all the time, and sometimes presence is not quality. Like I'm there, but I'm not there. Like we have a joke, physically present, but mentally absent. That's how it is. But I'm tired of that. I'm not saying that I don't like nursing. I love nursing. You know, there are um, wins that no one can give it to you. When you see your patients discharged and getting well, when you see improvements, when you see progress, when they come, it seems like the prognosis is called poor. It says on the chart, poor prognosis, but then discharge well. So those things, those little things, because when you see them suffering and then the transition into getting well, the feeling is priceless. But the job itself, the nature of the job, the unpredictability, the stress that surrounds it is too much for our body to absorb since we graduated, right, and practiced nursing on the bedside. So when we are younger, fine. But now that, okay, I'm on my 50s, so my body respond all of this stress is different. So I'm kind of like feel exhausted, like really exhausted, mind and body. And when I go home, when I sit down, you know what happened when you sit down? So your body would just shut down and take a nap because that's the natural response, right? But I could not go with this life forever like that. And I'm on a retirable age and I want to enjoy my life. I want to enjoy a stress free life. But however, I'm not breaking the bank, right? So, yes, nurses, I'm telling you, we have the skills, we have the time management of the whole wide world. Can you imagine? We're taking a lot of residents and still we were able to do the job, the task that we need to do on our shift. So that's time management right there. Um, we know how to delegate because we become church nurses, right? And also we have this super instinct, like how to prioritize your work, how to prioritize your care. And also, we don't take no for an answer because we know that if we will do that task, our patient needs it. And there's life. It's life threatening if we miss that window, small window of observation too. So, you know what? We all have the skills. Now, we transition from paper charting to computerized charting to uh, dispensing the medication. We transition from manual to using technology, and we all survive. So what does that mean? That means that we are capable of learning new skills, and these new skills can be of our own advantage. So because I keep looking for something outside from nursing, not because I hate nursing, but my body tells me I need to stop putting my body into the stress mode for 8 hours because I work 8 hours. But well, for those nurses who works 12 hours, then that's 12 hours too. So yes, there is a way of transferring, using, utilizing our skills to somewhere else, and that's called transition. So there are a lot of ways. Now, if you are one of these nurses that is looking for something to transition um, with, you know, with your life, a change in your life, there are ways. So I'm telling you, I'm looking and I found one. And because of its flexibility, I can do it on the side while I'm still working on my 8-hour job. And if it can be done, it can be done because our skills is there. What we need is a system that we can plug in that works. We are not reinventing the wheel. We are not doing it from scratch, but it's there for us to use already. So if this resonates with you, you have the pain points, you have the why, the reason that you have to transition from bedside to a quality life. Chat with me. See you in the inside. My website is down below on on the screen, and you know, sign up and then learn and be informed. There's nothing to lose because that's my complimentary webinar for you. Bye for now.